All right, we are live. Okay, we are live. This is Senate Finance on March 18th. And we are starting our long walk through our crossover. So my plan committee is I'm going to try and knock out these bills that just have some kind of a fee or registration in them, like as quickly as we can. I am, two bills I know we've got that there's some testimony on it. Giving all day tomorrow to S65, which is the Efficiency Vermont bill. And then we have a housing tip bill that's come to us. I'm going to give that all day Thursday. Fair warning, we may be working into the evening. I don't know how long. We haven't scheduled testimony, but then there's what we do with it. And then Friday we'll do cleanup. And anything else that's that we haven't gotten through. I'm not sure if we should try to start at 1 o'clock, because if we're on the floor at 11, and I'm pretty sure as we start to take up these bills, we might run a little late. If we run late, I'll just see what the agenda looks like, just kind of stay in touch. I'd like to give you a chance to catch your breath and eat, but it might become necessary to eat here.
Let's shoot for 1 o'clock.
But we will shoot for 1. Okay. So first, today we are going to take up S46, an act relating to the taxation of vehicles used for forestry operations, and Michael O'Grady is here. Just a real quick walkthrough. I gather there's a tax or more than one tax exemption in this bill, and that's why we have it.
That's correct. I apologize. I left my iPad at home, and the replacement iPad that IT has won't recognize me for some reason.
Oh.
So those should work. So I will be working off the paper, but you should all have the Committee on Transportation's amendment in front of you. It's dated 3/13/25 with the 6:31 p.m. timestamp.
Is this a strike all amendment?
Yes, it is. So again, I'll start anew. This is Mike O'Grady with Legislative Council. 2017-2018, you enacted a purchase and use exemption and a sales tax exemption for certain types of motor vehicles and forestry harvesting equipment that is not motor vehicles under the sales tax. But at that time, you did not exempt motor vehicles used for hauling or transport because of concerns of whether or not they would be used for other purposes. But since then, the Vermont logging and forestry industry has generally been in an economic downturn. Many of the mills that the loggers have been going to in Vermont have closed, which means they have to truck further distances. That means that they need new trucks. The new trucks are more expensive for various reasons. Inflation is one, but also because of the new emissions reduction technology on those trucks. And they are also competing with the mills that they have to transport to with other state harvesters, specifically New York and Massachusetts, who already have exceptions from their purchase and use or sales tax for motor vehicles used for hauling or transport. So the bill was introduced at the behest of the industry. It would have had a sales tax exemption and a purchase and use tax exemption for those vehicles used for transport and hauling of equipment used in the logging and harvesting industry. Logan will tell you about the fiscal note, but the original fiscal note based on the bills introduced was significant. Consequently, the Senate Transportation Committee removed the sales tax exception and qualified the purchase and use tax exception. It amended the existing exception to be clear that repair parts, when sold as part of the vehicle that's used for harvesting, timber removal, processing, will qualify for the purchase and use tax. And that's when those parts are sold with the vehicle. When you're getting the chains or the spare tires and they're not being charged differently, separately from the vehicle, that they will also be part of the value that is subject to the exception for those types of vehicles.
When I buy floor mats, when I buy a car, are they part of that?
I don't know that these vehicles have floor mats.
No, but I
They
mean,
have-
yeah, for a regular car purchase, you can get mud flaps and floor mats and trunk liners.
Well, here, there are things like replaceable winches, which can be sold with it, and it's a repair part, and it would qualify.
It's tax exempt.
That's tax exempt for the purchase and use tax.
Purchase and use tax goes to the ed fund.
Yes,
Is the,
I can't remember, Logan's got the breakdown.
But yeah, but some of it goes to the ed.
Yes.
the fiscal note is not linking on our website. I don't know if it,
I just
Did you
posted
just
a revised,
Okay.
but it might take a second.
all right,
Okay.
So, but there is an additional exception that's added, but it's qualified. It's not for all motor vehicles used to haul logs or equipment. It is 50% of the final tax imposed under the purchase and use tax on the following motor vehicles, including their repair parts used for timber cutting, timber removal, processing, or transportation of timber or equipment. Would be semi-trailers, tractors, truck cranes, truck tractors, trailers, and motor trucks, and motor vehicles with the manufacturer's listed gross vehicle weight of 10,000 pounds or more. So those would be 50% of the purchase and use tax for those types of vehicles would be accepted. DMV said that they would be able to do that calculation. There's also language in here that says that DMV may require a purchaser at the time of purchase to certify that the motor vehicle or other equipment is exempt. Kind of like how agricultural equipment under the sales tax has to be used for 70%, and the purchaser has to sign certification that that's how it's going to be used. And then DMV will publish, is required to publish guidance on how this section applies, because there's big confusion in the past about what is exempt and what is not is exempt, and how certain types of equipment have the exemption applied to them. And then it would go into effect July 1, 2025.
Okay. Questions? Michael? Not see it.
The overall fiscal impact program.
That's Logan has that.
Okay.
This is more limited than it was,
Pardon?
but there's.
The original fiscal note was much bigger than the current fiscal note. Now that Logan talked to that.
Okay. Okay, come on up.
Right.
Okay, I've got to come back to something real screen. All right, that sounds, okay. Now,
Yeah.
yep, you just have to update, all right.
So for the record, Logan Newberry with the Joint Fiscal Office. This is the fiscal note for S46 bill that we just heard all about. As was mentioned, this bill will provide sort of a tax break for certain vehicles. I have them listed here. It's a longer list. I won't go through them all. This will give them a 50% discount on the purchase and use tax. Currently, oh, I should also mention, as you heard, the gross, if they have a gross vehicle weight of 10,000 pounds or more, they'll be exempt from this.
That eliminates your pickup trucks, your
Big, your semis, your pickup trucks, other things like that.
but these are real big.
Yeah,
That 150.
yeah.
Okay.
So,
Like people of logs.
right. Currently, these vehicles are subject to a 6% purchase and use tax. This is 6% of the value of the vehicle. I do want to make note that trucks weighing over 10,100 pounds, they have a maximum tax levy of $2,486. So as proposed, these vehicles, assuming they're engaged in one of the applicable forestry operation activities, which there's a list in the bill language itself, they would be eligible for essentially get half off on their purchase and use tax that's levied on any of these new vehicles. So moving on to the second section.
Can I ask, so if their current maximum tax levy is 2486, they would get 50% off of that. So we're talking about 1243.
So yeah, so if a vehicle was before this proposal being taxed at the max 2,486, they would get half of that. So 1,243, if my math is correct.
Can I assume the saving grace is we don't sell a large volume of these vehicles?
So yeah, and this gets into sort of the difficulty that there was in trying to determine an estimate, is that we don't have great data on forestry vehicles or vehicles being used in forestry industries. So the conclusion we did come to is that this bill, as written, would reduce the purchase and use tax by approximately $500,000 annually. And as was mentioned, the purchase and use goes to both the transportation fund and the education fund, and 2/3 to the transportation fund, 1/3 to the education fund. So that would mean this bill reduced transportation revenue by roughly $333,000 annually, and education fund by roughly $167,000 annually. And then the third section is just to make note of sort of some of the difficulties with estimating the cost of this bill. As I mentioned, the general lack of data on vehicles engaged in forestry operations was a relatively large constraint. And then the other ones there, I won't go into all the details, but essentially, I used essentially a proxy to determine the eligible vehicles that might qualify for this out of all of the new vehicles that are purchased every year, and determined a rough estimate of approximately $500,000.
Okay, so you took the ones that are under that $2,400 cap.
Yeah, so I looked at all vehicles over 10,000 pounds registered in the state of Vermont every year, and then tried to determine what would be a reasonable percentage of those vehicles that could reasonably be engaged in one of these activities that would qualify for this purchase and use exemption, to come up with the $500,000.
Senator Hardy.
Is there a requirement that these vehicles be used in Vermont?
I'll defer to Ledge Council, but I believe it's just that they're used in forestry operations.
Okay, it seems like if we're giving them a tax break, then they should be used in our logging and forestry operations.
I believe the testimony was that New Hampshire, Massachusetts, and New York.
New York have their exemptions.
They already do.
Yeah.
Maine is working on
So
it.
they would have to be registered in the state of Vermont. But I guess where the
Okay.
forestry operation occurs isn't specified, as I
But
understand
the
it.
business would be here if it's registered.
Theoretically,
Okay.
I don't know if there's a
And
situation.
do you know if they got testimony in the transportation committee that this would help the industry? I mean, because if the point of this is to help the industry, if they're just getting a $1,200-ish tax break on these giant vehicles that cost a lot of money, then I'm not sure that, I'm just curious how that is going to have such a big impact because, and the reason I ask is because both the education fund and the transportation fund are really struggling right now to meet demand. And so if this is going to be a tax break that has very little impact, is it basically getting a bang for the buck?
I was saying, Mr. Dakota, you representing anyone in this?
Yeah, the Clark Macco with Meadow Hill representing the Associated Equipment Distributors. These are the dealers in Vermont that sell equipment like skidders, delimbers.
Okay, so that doesn't help us with the state of the industry, not representing the, where's? Oh, that's
I'm curious.
you.
So I just want to note that many of the sawmills that were in the state are now closing, which means that the loggers have to take their equipment out of state, so they have to use these trucks out of state to get to the mills that are processing or to Canada.
But they're logging the logs in Vermont.
Right, but
taking them out of
this-
state.
The second part of the exemption is for those trucks that are moving.
No, I see what you mean.
And they argue that there's already 12% federal excise tax on this equipment. And that if you put the additional 6% on it, they're at a disadvantage with others from New York and Massachusetts who don't have to cover that cost. And they need these trucks. This is their argument. They need these vehicles in order to remain competitive in the now regional market, since there's no or very few sawmills left in the state.
Okay.
I know with some types of trucks or trailers, many people who use them in Vermont are registering them in other states that are much more favorable, neighboring states, for example. Was there any testimony that this is also part of the problem? An attempt to get more stuff registered here as opposed to registered elsewhere?
Not that I know of. I have heard in the past that it's difficult to buy the equipment here. Some of the equipment, so you have to go out of state, especially if you're buying used equipment. But I did not hear that testimony with regards to registration. Malfeasance.
There were truck trailers. I thought that Maine had a very lucrative.
Right.
On, that's the one thing I
remember that too.
heard. Yes, and I forget which committee I heard that in, but apparently.
You and I were
one
both
of us
on that
was heard
committee, whatever it was.
Yeah, I heard it too. It must have been in here a couple of years ago.
That Senator Chittenden.
I'm sorry if you said this, but will this bring us to match New York and Massachusetts, or will we be cheaper than them with this discount?
So, they have no tax. And so this would be 50% of the purchase and use tax, so
We have that.
we won't be as. Not the same.
I think like many things, it's kind of a vote of confidence or show of our support. Because, yeah, that amount of money is not gonna make a difference between somebody going into bankruptcy or not. But it is kind of a goodwill gesture frequently that we're trying to help them. It's fairly cheap, the goodwill gestures.
I was just gonna add, given the fairly substantial tariffs that we're gonna be putting on Canadian lumber, specifically Quebec lumber, I think it is not a bad idea to show support at this point for,
Maybe we'll get some sawmills back.
yeah, I mean, as much as I hate to see money taken out of the ed fund, we're also gonna need the wood to build schools. So
That's right.
it's all,
Housing, we're getting a housing
Wooden
bill
schools.
bill this week.
sure, wooden schools, single room schoolhouse.
Great point.
All right.
Looking for motions now, or? we gonna see all these
I'm
things?
looking at the committee. This is the set of witnesses. I'm going to assume the transportation heard from the logging industry. We can hear from them too. I'm just wondering who, what, when and where you'd like to hear.
I guess you always balance these kinds of issues of giving a tax break for a particular industry is what's the return on investment?
Yeah.
And that we're very bad at doing because JFO doesn't really have an economist or a set of economists to do some projections. We're in a tight situation as far as money. We're faced with higher expenses and higher costs that we're anticipating. We're looking at potentially the loss of federal funds and so on. So I would think we need to be very, very careful about giving out tax breaks, particularly on funds that we're desperately short of right now. So I would love to be able to get a better idea of is it necessary? And what will we either gain by doing it or what will we lose by not doing it?
Yeah, that was sort of what I was, is this gonna give us a bang for our buck? I know the industry's struggling and I hear all the
I'd love
arguments
to,
for it. I'd love to be
help
able
them
to
at the
do it,
same
but
time, but you
yeah,
hate to shoot yourself in the foot.
Okay, should we
Can do it.
see if Senator Westman can come over and talk to us? Would that,
It'd be helpful.
yeah, we'll get it.
I mean, the T funds
We're
take
probably
they were
gonna
hitting the edge of
be
the
minutes late on.
they have far less money for leaders.
Bills.
I would just echo Senator Bullock's comment that this makes it a little bit easier to buy some equipment to get trees and lumber in the States. against the Canadian tariff times. That this makes it
Well, no, I was in the same one upstairs.
I was gonna say, we raised DMV fees 20% a couple of years ago, so now we're just kind of give a little bit of a rebate back on this.
they're voting over there,
Person used to.
Oh,
but he said he would come after the.
after he votes. Okay, that shouldn't take too long. There's only 7 of them.
And I'll push back on the
Which one?
bang for the buck
For
and the tax bill that we have no idea the impact of
Okay.
just last week.
We're gonna let.
Millions of dollars,
Senator Western,
yeah.
bid.
Point.
Come on up.
Unpaid.
Okay.
No, that.
Yes, what is happening is we are looking at the sales tax exemption
No,
on
it purchase and use
use
tax.
tax
We
exemption,
took the sales
That's right.
tax out.
the purchase and use on logging equipment, the big trucks. The question, the,
And we set it at 10,000 because what we were
Yes.
using for a bill didn't have any limit on, and we set it at 10,000.
Pounds.
So 10,000 pounds, so you wouldn't be tempted if you had an F-250 to make a claim. We were, a lot of people that have the trucks that are out there, they pick their kids up, they go
Yeah.
drive around on the roads and it might becomes question.
I'm pretty sure my one-time dump is over 10,000 pounds for GBW.
okay. So the question is, the fiscal note is so minimal. And given the present fiscal unknowns that we're facing, we were setting up a reserve fund for farmers. If it's a $500,000, more or less, is that enough? Take the money out of the transportation fund and they're losing 333,000. And the ed fund at 167,000. I think the question was, what's the return on our investment? If we give up that money right now, none of our money is guaranteed. Is that enough to keep the logging industry afloat? Is this a make or break?
I think, the testimony we took, the logging industry is hurting.
Yeah.
There are, mills going out everywhere in the, last 2 years particularly. It's been very hard on people in the, forestry, in the business of, cutting timber and everything. And we, were convinced that doing something for the group, at least tipping our hat and doing something for the group, was, an appropriate thing to do. I think if we had had our druthers, we probably would have done something with the sales tax piece, because the sales tax side was
So it goes into the.
what was really the side that they cared about the most. We didn't feel comfortable in transportation giving up the sales tax when it's the purview of this committee that deals with the ed fund. And that I think clearly, as bad off as that group of people are, we didn't want to say no. The difficulty that we're in is we're facing a transportation bill this year that we go from, in the present year we're in, we're paving 220 miles of road. That's dropping to 123, which puts us on a rotation. If we kept that up, that we would only be paving our roads someplace between once every 25 and 30 years. And we're in a place where we're looking out to next year that will be even worse. Next year's hole in the transportation bill, after the budget that we're working on this year, the budget that will be presented to us next year, we have at least a $30 million hole. If, and with that, we would on average have to leave $180 million in federal money on the table. So we're in, and I'm being conservative, we're in a world of hurt. That grows to a $45 million hole the year after that. We're the only major fund where the bulk of our revenues does not grow over time. In the general fund, with the income tax, with wages going up, you get an increase. Even in the ed fund, I think all of us know that real estate over the past 5 years has grown dramatically. In the transportation fund, with gas taxes and fees that are flat, we're in a world of hurt. And we didn't want to say no to the forestry industry because we know that they're hurting and we know that they need help. And a little bit was better than nothing.
Okay, thank you, Chair.
The most compelling argument I've heard for this so far was the comment that Senator Gulick made before you entered here, which is in light of the Canadian tariffs and the lumber industry and trying to make it a little bit easier or enticing to start to harvest some timber here in Vermont. My question to you is, in your discussions, did you consider I believe the technical term is a prospective repeal, which I like to call a sunset, but I know Ledge Council likes to call it. Had you considered putting this in place for 2 or 3 or 5 years just in order to come back to it?
We actually did.
Okay.
And we talked about that in committee. The senator from Wyndham brought that up. And it didn't make it in our final draft. We were in a push to get through. I don't think we'd be opposed to that. But I think this industry is looking for some stability and some nod that there's some help out there. If you wanted to do something more, I think they would welcome a sales tax exemption. Joint Fiscal hasn't been able to come up with any estimate that we could hang our hat on. And we didn't feel that was ours to put in. This is a group, this is an industry that's hurting.
Okay. Any other questions, for Senator West? Senator Harding?
So given your rather weak description of the transportation fund, I mean, can it sustain this reduction in
Well,
revenues?
the piece of the problem with what we were handed is and part of our thinking around what we could give away, the administration came in with a miscellaneous DMV bill, which you have in this committee now. They made a suggestion in a number of areas, one of which you're going to see is to take the fees off from licenses and things for people that are on SSI and SSDI, which is the poorest of the poor in our society. And we wanted to do something for that. And we made some and then there was also a fee for if you went online to print your documents out in paper. We didn't do that. The administration didn't make those numbers into their budget, so we will have to deal with that hole in the budget. So we tried to keep our numbers in total around that. I would clearly say that was our number one want to do, is help the population on SSI, which I don't know how those people that are in that position survive. So we did try to pare this down as much as we could and at least give a nod to that industry.
Okay,
Okay.
so,
Yeah,
that's all right.
we do have the transportation bill in here, so.
Yeah, you have the miscellaneous DMV. bill.
Yeah, so we could hold a decision on this until we look at that one.
That would be helpful. Okay.
We had the opportunity to look at the picture of things that we might give money away to.
Okay. Thank you. I think that helps us put it in perspective. We don't get in the last meeting. Thank you.
Thanks, Rich.
I think next we're going on. Oh, sorry. Jeff Harvey is sitting here. That's this week's agenda. Where is this week's agenda? There it is. Okay. Oh, we're only 10 minutes behind. S63, this is act relating to modify the regulatory duties of the Green Mountain Care Board. I'm trying to remember what we did on this one. D.
Small amendment, yeah, there's change to bill back in some fees for
That's right. Okay.
ACO.
I now remember what we did. Okay. All right, Jen.
All right, good afternoon, Jen Carvey from the Office of Legislative Counsel. So I thought if you would like, I will put these up on the screen. I think you have 63 first. Up.
You're 53.
63.
63.
We also have 53. So S63 is an act relating to modifying the regulatory duties of the Green Mountain Care Board. And I don't know, Madam Chair, if you just want me to focus on the money pieces or give an overview of some of the
Just
other
why I think it would be helpful just to give a little background, like this is a response to the demise. And so the bill back needs to be moderated kind of thing. I don't know.
Right, this bill makes changes to several different Green Mountain Care Board duties, some of which is in response to resource issues that they're having with the work that is on their plate. And so it takes out of their responsibility, out of their list of duties, some authority related to health information technology and the Vermont information technology leaders. The big thing that it does that brings the fee changes into this room, deal with the wind down of One Care Vermont, the big accountable care organization. that was a part of Vermont's participation in the all-payer model, and with them winding down at the end of the year and no other ACOs of that size coming along, there was interest in changing the bill back allocation. Some of you may recall in statute, the Green Mountain Care Board can bill back a portion of its expenses in regulating entities to the regulated entities, and it's in a 40-60 split. 40% state funds, 60% is allotted to the regulated entities. And under the existing statute, that breakdown is 40% state, 28.8% hospitals, 23.2% insurers, and 8% accountable care organizations. Accountable care organizations funds largely came from the 2 large hospitals that were involved. So this would take most of that 8% allocation and put it in the hospitals column with a small amount in the insurers column. So keep the 40% for the state, but now the split would be 36% hospitals, 24% insurers. And these are the description here of the 3 types of health insurers that we regulate. So that's the first big ACO related piece that brings the bill here. The other is, this is listed the board's duties. The other is in the ACO statute itself. This is where the board has oversight of ACOs in 18 VSA 9382. It makes a lot of changes to the work that the board would be doing because the expectation is that most, if not all, of the ACOs that will be operating in the state will be Medicare only ACOs. They'd be operating through a partnership with the federal government, but would not be involving our commercial insurers or Medicaid. So this would kind of streamline the process for certification with a lot less information gathering and focus on care coordination that is in the existing statute. And then it also makes some significant changes to the budget review statute. One of the main pieces of which is it would be specific to ACOs that are receiving payments from Medicaid or commercial insurer, which again, after the end of this year, I'm not aware that we expect to have anytime soon, if at all. And so let's see then in the more limited budget review that they would be doing, even if there was such an ACO operating in the state.
Okay, so we lost the large ACO
Yes, we are about to.
that was looking at commercial insurance payments and going to global payments to hospitals, and they are ceasing operation. There are smaller, as far as we know, Medicare only ACOs that work on a contract with the federal government, or that's who is.
In some form, yeah, we have very little involvement with them, although obviously they're still interacting with Vermont patients, so
Yes.
the state wants to have some oversight there.
But this just adjusts.
Right, this adjusts the scope of the board's ACO regulation to account for the ACO population, the actual accountable care organizations that are likely to exist. And setting up some parameters that they needed to certify and do a budget review in the future. And you can see that I think reflected in the expectations. The expectations reflected in the fee amounts. So this is new provision that would set $10,000 fee for an initial certification of an ACO, and that's any ACO, including the Medicare only. A $2,000 annual renewal or certification maintenance fee, and then if they do a budget review, that would be $125,000 fee.
And this is to cover their cost. We didn't have any.
There was bill back.
Yeah, that gets a little objection, but I don't remember any testimony playing about this.
I don't believe there was. There may not be anybody who's facing the potential for the fee.
Yeah,
Who would be in a position to be registering their thoughts. And then Section 6 and 7 are around the timing of the fiscal year for hospitals, with a different one allowed for psychiatric hospitals not conducted, maintained, or operated by the state. Section 7 in the bill as introduced had some additional provisions around the hospital rate review process and its relationship to the contested case process in the Administrative Procedures Act, but the committee's amendment is just simply to strike that and only address the hospital fiscal year business.
Okay. This is somewhat of a housekeeping bill coming out of the basic one pay Care Vermont going out of operation this year. And I am not seeing the hospitals representative in the group. So that's hard to
Can I ask Jen a question? Yeah. On the bill back, percentages on page 6 and 7. The little I, triple little I. What do you want to call it?
Allison would know the word for that.
It's Romanet 3.
Romanesque.
Like little Roman numeral, Romanet.
So Romanet 2 is hospitals, and then Romanet 3 is nonprofit hospital and medical service corporations. I'm assuming that is nonprofit hospital and medical service corporation as one thing, yes?
Yeah, it's the
Okay.
yes, it's what Blue Cross Blue Shield, a lot of their plans are, they are registered as a nonprofit hospital and medical service corporation. So
Okay,
that is not a hospital at all. It is one of our 3 insurer types.
okay, because I was going to say, I think all of our hospitals are actually nonprofit.
They are,
hospitals, so
but
that's
yes, so this is insurance.
Okay, and then within the 36% for hospitals, are the hospitals billed at varying rates? Or are they
I
all?
believe it does not address it. No, it's just about the premiums. I would phone a friend if Nolan knows what the,
For the record, Nolan, I'm on the joint fiscal office. I think that they're charged based on the amount of work that's done. So it doesn't have to do with their size or their budget, but how much work the board has to do in reviewing their budgets or whatever the regulatory work is. So it sort of works out in sort of that kind of way.
Hmm.
But it's, yeah, just how much time and energy and staff resources are used in the regulatory duties specific to the bill bag for that specific hospital.
So I mean, reviewing, I wonder how much. Reviewing a budget is all about the same. I mean, there's some more complicated. I just wonder if the largest hospital is charged more.
I believe it's done by the amount of staff resources needed to do the actual work.
Yeah.
I think we can feel comfortable that they're probably charged more.
I mean, their budget is bigger for
Gone
sure.
in this year.
And they are definitely a problem
Yeah.
child, but I'm curious about that. Okay.
and then if you're interested at all in the amendment from the Health and Welfare Committee, as I mentioned, it really is just striking out section 7 as it was in the bill and putting in a new section 7 that is limited to the timing for the budget. The fiscal year.
And what are the psychiatric hospitals? Is it just?
It's really
Brattleboro Tree?
Yes. And it's my understanding that we made a change a couple of years ago that put their budget within the Green Mountain Care Board's regulatory authority. But they have a different fiscal year that runs on the calendar year, and all the other levels run on the federal fiscal year, October to September. This is to authorize them to be their same fiscal years to use.
So this is adjusting the bill back sections. Most of this is just to adjust.
Right, bill back sections and then the ACO regulation to the extent that is continuing in the future.
Committee, what is your pleasure on this one?
Yeah.
You need more testimony? And rather than a thumbs up, I would love a motion.
Maybe I'll look to our healthcare members and see if they.
I'll make a
I'm
motion,
for it.
I will make a motion to pass S63 favorably out these. Yes, S63 favorably out of finance
Yes, as presented.
as presented to us.
Okay. Then Laura Good has moved that we report S63 favorably as presented. Clerk writes that all down, we can call the roll.
Oh, we're good.
It's like the termite.
Senator Goulart,
Yes, please.
Senator Brock,
Yes.
Senator Chitnick.
Yeah.
Senator Beck,
Yes.
Senator Hardy, Senator Matos, yes, Senator Cummings,
Yes.
700.
Okay.
I've just got one question and I didn't want to ask it before the vote because it might have confused things even further, but why is there a different date? Pediatric hospitals as opposed to other hospitals in terms of the budget? Is there some reason for that?
Don't know that there's a specific reason. They hadn't fallen under our statute about when their fiscal year is set until just a few years ago. And it may have to do with the percentage of funding that they get of the payment they get from the federal government. And their licensure under the federal government, because the federal fiscal year makes sense if you're doing a lot of Medicaid or Medicare funds.
What do you do with a hospital, for example, if the medical center wound up being, Brogan wound up being the state's premier psychiatric?
Well, there's a
Hospital at the same
definition
time.
of psychiatric
Okay.
hospital in the statute.
Yeah, I don't want to get into, I don't.
Yeah, so it points to,
It
to
just struck
general
me that this-
hospitals.
why did we do that?
Yeah, and it doesn't cover any of the recovery centers or
No, it doesn't address them because they're
It's a
not,
very-
their budgets
specific.
aren't regulated by this statute, but I think it was an unintended consequence of putting them under the.
It wasn't a deliberate decision of the Department of Governmental Confusion,
No, I don't believe so. Although they don't consult on that.
Okay,
complexity expert.
I'm gonna move us on.
Who's reporting that?
SAT. And Jen is staying in the chair. Oh, no, Nolan.
And who's
We
reporting the
voted.
63 and?
Oh,
It's the last thing on my piece of paper.
we did not, we took a vote.
A reporter.
Oh, a reporter.
But I mean, it'll be health and welfare will report the bulk. of the
Yeah,
bill.
right. All we need to do is stand out and say.
Yeah, okay, yeah, I can do that.
Senator
Okay,
Douglas, I think, is doing.
all right.
Okay.
Now we're gonna move on to S18,
All right,
and that's birthing center.
it is. But this one. Next, we have S18, which is an act related to licensure of freestanding birth centers. In this case, we do have a strike all amendment from Senate Health and Welfare. And it starts by setting up a licensing structure for birth centers, defines a birth center, which I think may be useful for your purposes, as a facility, the primary purposes of which are to provide midwifery care, low-risk deliveries, and newborn care immediately after delivery for a stay of generally less than 24 hours. I'm not talking about a facility that is a hospital, is part of a hospital, or is owned by a hospital, a facility that is an ambulatory surgical center, or the residence of the individual giving birth. And birth center may be located on the grounds of a hospital. And then there's a bunch of other terms that get defined, but I think unless you have other thoughts, I will focus you on what the bill is here for. So there is a license required for somebody to operate a birth center. Here we go, here's your section. This is the application and fee. So there must be an application to the health department in a manner specified by the department, including all the information that they require. And each application for an initial license, renewal, or change of ownership must be accompanied by a $250 fee.
And we, some reason, I thought, I heard regulation and license and call Lauren Hibbert, but this is.
This is Department of Health.
This is the Department of Health.
Right. So Lauren Lehman had testified and had worked a lot on this with
this.
the advocates.
But We have not reached them, right, today?
No.
We're running this as a tight ship, so we have not been able to make contact with them, but there was testimony in health and welfare. This is just the fee, it covers the cost of licensing. Okay. We call these people unnecessarily.
Although they're here for the next one.
They are here for the next one. Okay, there are chairs over there, and I don't have an enforcer of occupancy.
That's what I do with health and welfare.
Okay.
So
So,
now, if you want to see anything else that is in this bill, I can just tell you, in addition to setting up the licensing structure and directing the department to adopt a number of rules, and the Department of Health licenses hospitals and ambulatory surgical centers. They work with their partner, the Department of Disabilities, Aging, and Independent Living, to do the survey and certification piece as well. There's also a requirement for health insurance coverage of these services provided at a birth center, including birth center facility fees, an exception from the certificate of need statute. So there's no requirement to get a certificate of need. We open a birth center, and with another bill moving through the legislature that increases the monetary thresholds, it's unlikely many of them would trigger that requirement anyway.
do we require insurance to cover midwifery services? Okay, so this should not,
In fact, this is amending the midwifery coverage statute.
to say if it happens in a birthing center or at home.
Right, exactly. Right now, services rendered by a midwife, a licensed midwife, or an advanced practice registered nurse certified as a nurse midwife. Their services provided in a hospital or other healthcare facility or at home must be covered. This is adding birth center.
Okay.
And making it clear that it's the whole scope of services, which are also services provided by those licensed professionals.
Okay.
And then there's a requirement to seek federal approval for Medicaid coverage. And it's would not take effect until the earlier of the date that the birth center rules take effect, or January 1st, 2027. And some additional provisions around insurance and Medicaid.
Okay, questions for Jen? Okay, if not, Nolan, you wanna come up this time?
I'll be quick
Okay.
and shouldn't need to go far.
Well, that.
For the record, Noel Nagel, the Joint Fiscal Office, I'm not gonna pull up the fiscal note. But just please note, there's a fiscal note for all three bills you're hearing. The last bill you just heard, there's a fiscal note. There's a fiscal note for this bill, 18, there's one for the next one too. So they're all on your
Okay, well,
information.
one note.
This one's super simple. If you do go to the fiscal note, the last, on the end, the bottom of the second page, the summary, S18 would have no immediate fiscal implications on the state budget. Your revenues are anticipated to be nominal and will depend on how many applications how many applicants apply for the licensure and subsequent renewals. The other thing that I like to note, if I can, or in these kind of situations, is that evidence suggests that potential for savings in Medicaid, evidence suggests the potential for savings in both the Medicaid program and the state employee health plan, depending on access to utilization of birthing centers once they come online. I say that because whenever we do any kind of program like smoke cessation or other stuff that have evidence and empirical evidence that they're savings, I like to acknowledge it, but I can't book it. We can't book the savings because they're down the road. It depends on how the utilization or when these things come online. But it's worth referencing and noting that there could be savings on the road. So I just wanted to sort of note that.
I think the biggest concern in health and welfare was the possible impact on rural hospitals. And the settlement, because if you take, there's so few births in the hospitals right now, if you take any significant number it out, they may not be able to maintain that service. But the numbers we got on the number of births versus the number of births in the hospital, and I don't know Do you have that, Shayla? Do you want to come up and give us those numbers? Yeah, that'd be great. First, any questions for Nolan?
Can I ask just a quick question?
Yeah.
I don't see the S63. I know we just passed it, but there's no S63.
Oh,
63.
I'll
Fiscal note.
send it to her.
Okay.
I literally just posted it and I may have neglected to send it to the system. So my apologies. I will do that right now.
Okay, so.
That's my fault. Not the system. It's my fault. I'll do that right now and I'll see you.
Just want to make sure I vote in the right way.
No, sorry about that.
Hi, everyone. I'm Shayla Livingston. I am a member of the Vermont Birth Center Coalition and a resident of Wilson, Vermont. So like the chair just mentioned, the hospital did bring up concerns about their census and the number of births that happen in their birth units today. I'm sure folks are aware there are some hospitals considering closing their birthing units. Right. The number of births that these freestanding birth centers, so it's a little tricky, we think birth unit for a hospital, freestanding birth center for these new entities that would be licensed under this bill. These new entities, we believe, would mostly be taking births that are already going out of state to seek this care elsewhere, because all of our border states have birth center options. And so women who are looking and choosing that are leaving already. And there is a contingent of people who choose home birth right now, and who might instead choose the freestanding birth center if that were available. So we think the majority of the patients would be coming there from those groups and entities. But that there would be some people who are currently delivering in birthing units in hospitals who would choose to go to a birth center instead. We don't know the total number, but we can tell you that these birth centers would be very small. So probably doing maximum of 100 births a year. We know of one person who is interested in opening a birth center here in Vermont. We are guessing there will not be very many, unfortunately, that end up being opened here just because of the same workforce shortages and demands that we know exist in the rest of the healthcare system. So we're looking at probably one or two. So that's maximum about 200 births a year. Again, when you look at the numbers of people from these smaller hospital units who are leaving their catchment area to deliver in other places, that far outnumbers the number of births that these centers would do. So for example, up in North Country, you've got about 150 people leaving their catchment area to deliver other places. Down Bradford Memorial, same thing, about 150 to 200 people in that catchment area going other places that are not Bradford Memorial. Some of those, of course, need to go to tertiary care centers like UVMMC and Dartmouth. But many of those are just choosing other options. So there's not evidence from any other state that these have closed down hospital units, and it is absolutely not the intent or desire of the midwives working towards this, that any hospital units close. Definitely not. And in addition, not because of them, we would hope that these would be working in partnership with hospital birthing units and or hospitals who don't have birthing units, depending on the scenario.
I was just gonna add that we're one of only 8 states that don't have birthing centers.
Okay. Questions?
I made a motion then, if you like. Yes, that's if we're ready for that. So I would make a motion to pass S18
As presented.
as presented in Senate Finance, favorably out of Finance.
Okay. So Laura Bullock has moved that we report S18, an act relating to the licensure of freestanding birth centers out of committee favorably as presented. Is there further discussion? Not, clerk call the roll.
Senator Hardy,
Yes.
Senator Brock,
Yes.
Senator Chitnick. Senator Gulick,
Yes.
Senator Beck,
Yes.
Senator Meadows, yes, Senator Cummings.
Yes.
700.
Okay.
Reporter?
Sure.
Martine?
Yeah,
Very
yeah, I'm
Okay.
happy. Popping up.
Pardon?
If I can say one thing about that.
Yeah.
So I just heard that people sometimes go out of state for these birthing centers, so this will make more Vermonters.
No, they come back with the babies.
Or.
I love it.
Unless they're going to Canada, then we're going to lose Canadians. I'm sorry I had you guys come over.
No work there for the next one.
We're gonna get to the next one too. Okay.
Last one for me,
53.
that's 53.
Okay.
Now we are looking at, keeping with the first theme, no,
Oh,
is an activating the certification of community-based perinatal doulas and Medicaid coverage for doula services.
okay. I hope somebody else will report this one.
So we'll start with some definitions, and then I'll talk about the money stuff, but just so you know what you're talking about. This stands up a new chapter in Title 26 to certify community-based perinatal doulas. It's a voluntary certification that would allow them to participate in the Medicaid program as participating providers. So the definition of a certified community-based perinatal doula is a community-based perinatal doula who is certified under this chapter. Community-based doula is an individual who provides doula services to under-resourced and marginalized populations at low or no cost, often through a community-based agency. A community-based perinatal doula is a community-based doula who provides doula services to individuals during the perinatal period, which is also defined in here. Director is the director of the Office of Professional Regulation. Doula is a non-clinical, non-medical individual who provides direct emotional and physical support and educational and informational services to birthing individuals before, during, and after labor and childbirth. And perinatal is the period of time encompassing pregnancy, childbirth, and up to 1 year postpartum. So these are not midwives, these are not medically trained individuals. They are providing emotional and physical support and information and education for the
Then your mother used to.
after labor and child. Perhaps. So it requires someone to, or prohibit someone from using this state certified or certified community-based perinatal doula title unless they are certified under this chapter. Spells out the duties of the director, including administering fees. We'll look at in a moment. This is an advisor board, so they're supported by two certified community-based perinatal doula advisors who would advise the Office of Professional Regulation. There's eligibility for the certification, including paying the fees, renewal every 2 years if payment of the required fee is provided, and proof of compliance with any ongoing educational requirements and professional conduct, uses OPR's regular statutes on that. And then we've got some related statutes. This one adding community-based perinatal doulas to the professions that are attached to the Office of Professional Regulation. Section 3 is adding them to the list of professions for which OPR may inquire into the criminal background histories. And then we get to the fees. So here's where you come in. Section 4, these are just adding to the OPR fees. And we have application for licensure or certification. And for community-based perinatal doulas, it would be $75 with the biennial renewal fee of $120. So those are the fees, $75 the first time, $120 biannually thereafter. And then there would be a requirement for Medicaid coverage of doula services. Some legislative intent on the sufficiency of the rates paid to doulas providing services in Medicaid, directing the state to seek a state plan amendment from the federal government if needed, which it is not included in our.
It would require an adjustment of the state plan, and there was some concern on the part
Yes, I think there's a question about whether state plan amendments will be entertained at this time or what the receptivity will be to
What
making
needs to
changes.
call attention to us.
Yes, but that doesn't affect the fees. The fees
Right.
are the fee. I mean, they do in the sense that if nobody's able to get paid under Medicaid, there may be a disincentive to seek certification. The thing that, because this is a voluntary certification program, it does not prohibit someone from continuing to provide or beginning to provide doula services without becoming certified. It's just a matter of whether they would be eligible to be paid by Medicaid.
We had testimony from the doula who worked for Washington County Health. And I believe she was a perinatal doula, but
Well, I mean, perinatal is just the whole
Yeah.
before, during, and after
she,
labor and delivery.
yeah.
So I think that it's the broadest form of doula, but I think that's what she is.
So there's no, you don't like go to school to be in.
There are various ways to become a doula, and I might let other witnesses tell you more, but this is kind of describing the eligibility for certification. It's describing that the person would have sufficient and appropriate competencies, whether acquired through experience, mentorship, training, formal education, or a combination. There's lots of ways people become, but it's not a degree program.
Recently. Yeah. I see if you want one.
It's kind of formalizing what your mother and your aunt's family that used to wrap around in some cultures used to do. We're finding people don't have that. We find people that come from different cultures are frightened, confused. They don't speak the language. My first delivery was in a communal labor room, and the woman next to me was Vietnamese, didn't speak the language, didn't want the doctor anywhere near her. She could have used the doula that spoke her language. She had no one with her. It would be that kind of thing, someone that would be there and tell you, this is normal, this is okay. This is,
Yeah, and also to advocate.
yeah, to help you find out what you can and can't do. Okay.
I have a question, but I think it's probably better for Lauren than.
Yeah, that's what I was gonna call. And Lauren, I don't know who you've got. Who's gonna talk?
Can we both sit at the table?
Sure. Just bring a chair. with you.
We'll bring it there.
Sit up here.
Good afternoon. Lauren Hibbert, Deputy Secretary of State, and I have with me Jen Colin, who is OPR's General Counsel. And for the most part, she's going to lead the testimony. I'm here just as backup, really.
You'll know I need to spend licensing fees anymore.
Well, that's why I'm here as backup.
Hi, good afternoon. Thanks for having us today to testify about S53 regarding certification of community-based perinatal doulas. Hopefully you got our written testimony. We submitted it just a little bit ago. So as you know, the General Assembly determined in Act 97 of 2024 that it's necessary for public protection for the state to regulate perinatal doulas. Act 97 required OPR to do a sunrise review of that profession and determine the appropriate form of regulation. OPR recently completed its review and submitted a report that's available on the legislature's website. And in that report, OPR recommends certification of community-based perinatal doulas as the appropriate form of regulation. That is, certification is the least restrictive form of regulation that OPR has available. And certification is a voluntary credential that a practitioner may obtain upon meeting certain prerequisite qualifications, such as approved training or educational programs, to your question. So there is required training and education and/or education. If this bill passes, that's something that we will develop in conjunction with stakeholders in the rulemaking process. Certification is not required of all practitioners, and those who obtain the credential are legally entitled to use the term certified in conjunction with the title. Community-based doulas serve Vermont's most vulnerable birthing population. Their specialized training and expertise assure that they have the necessary competencies to serve communities experiencing disparate maternal health outcomes resulting from systemic biases, structural racism, poverty, substance use disorder, mental health disorders, housing insecurity, trauma histories, developmental disabilities, and the like. OPR fully supports S53 as the proposed bill implements the certification program and allows for potentially future Medicaid coverage of the support services that community-based doulas provide within their own marginalized and under-resourced communities. It is anticipated that the provision of doula services to Medicaid recipients will improve short and long-term health outcomes and ultimately lower the cost of medical care, as studies and data have shown that doula support substantially reduces the cost, reduces C-section deliveries, low birth weight rates, preterm birth, epidural use, birth complications, and postpartum depression and anxiety rates. Doula support also provides better birth experiences for patients, improved maternal outcomes, and better breastfeeding outcomes. So to get down to the financial piece of this, the credential fees and implementation costs at OPR. You've seen in the proposed legislation, there's an initial application fee of $75 and a renewal fee of $120. Those fees cover the cost of administering the program at OPR, including but not limited to the list of items that I put in the testimony, assessing minimum qualifications to allow those folks to enter the marketplace of providing these services, assessing training and educational programs, providing assistance to practitioners during the application and renewal processes, fielding and answering questions from the public and practitioners, engaging with advisors and holding public meetings, enforcement expenses, ongoing legal, public records, and other general counsel type work. So that's what those fees would go to pay for. And OPR estimates that to stand up this program at the agency, it's going to cost us about $25,000 to provide some of the following things. Stakeholder engagement. We'll have to, because we'll need to engage in rulemaking upon passage of this bill immediately, we'll need to engage with stakeholders and do a lot of outreach, rulemaking, IT setup, website update, and communicating with practitioners, community-based programs, other state agencies to work with them on rulemaking and, those sorts of things. So that is what it will cost, we estimate, to stand up the program. Happy to answer any questions.
So I have two questions. One, so you said that the certification is not required, but it is in order to get Medicaid reimbursement, you have to be a certified doula.
I mean, that's what we expect. The purpose of the legislation.
And what about other health insurance reimbursement? Is certification required for that as well?
That's a great question. It's not one that I know the answer to sitting here. I do know that Blue Cross Blue Shield had a pilot program with doulas, and they since we don't have certified doulas yet, I'm assuming that the folks who participated in that program weren't licensed. But so health insurance programs could point to the OPR statutes and require that.
Well, I could just say we have seen historically that as Medicaid, Medicare starts covering services, the health insurances also starts to cover them. It can go the other way as well, but that can be an indication and has been an indication in the past of the private insurances starting to cover services if the public insurances do. But it's not a guarantee. You can think of a couple instances where that has occurred in that direction.
I think there is a reluctance, given the present fiscal issues, to put any more requirements on Blue Cross.
No, I know, but I think Blue Cross already does cover a lot of these services. So it was a question of whether or not they would only cover certified, but I guess that would be up to them. So my other question is, I think it might be for Lauren, but you're either one of you. Which I know that you were required to give a report this year on your sort of fees in general. And I was wondering what the status was and how this fits into that sort of broader picture of OPR fees.
Yes, so for reference, for those of you who are either not in a position or not in this committee, what Senator Hardy is discussing is the Office of Professional Regulation was asked to do a money study of all, basically of the financial structure of the Office of Professional Regulation. We welcomed doing that study because we have been at a deficit year after year. I think we're in our 4th or 5th year at a deficit. I'm very happy to say we're running at a lower deficit than we have previously. We're at 1.5 million as opposed to 2. So that's a win. And we've done that through some cost saving measures, being as thrifty as possible, making some hard financial choices. And we did file an interim money report. We've asked for another 2 years to study our money. And the reason being primarily that we felt like we didn't have enough data on a couple of factors. The biggest factor is we previously had not been tracking our staff's time by profession. So we implemented what's called positive reporting in the end of December, which means that Jen at the end of her day goes through her day and calculates how much time she spent on every profession that OPR regulates. This hour is not calculated towards anything because we don't regulate other ones yet. So this is a great example of sort of the problem that OPR has, is that we spend quite a bit of energy, as we should, on great public policy that we are not receiving any money for.
The optometrist, how many?
Yeah, we were talking about that this morning.
And the speech and language pathologists, I remember when they were
Home
in the
contractors.
halls of,
There's been many important policy questions that we've weighed in on that we have not received any fee revenue for. There's also been a lot of policy determinations, which are very good policies, like occupational compacts. That actually means that we receive less licensing fees because we are not regulating people. So nursing is our classic example. We joined the Nurse Licensure Compact in 2019, 2020. And as a result of that, we lost 1/4 of our licensing population in Vermont. And they were 1/3 of our total licensing population. So
just in total licensing population across all professions.
Yes.
Yeah.
And that has a revenue impact on us. We lost $1 million a year because we joined the Nurse Licensure Compact. And it's not a mystery that we're now at a deficit. We're also impacted obviously by the state employees contract, by IT costs. We have a lot of variables. So I don't want to digress too much, but we are doing positive reporting. We've asked for an additional 2 years to be able to review the data. I do think there's some big questions on the horizon, particularly around our enforcement division, because we play a broad public protection role that protects everybody in the whole state, and is currently borne just by our licensing population. So we want to think about that a little bit more as well. There's, as far as I know, outside of licensing, there's no other protection division in the state that is paid for only by fees. So I just would like to explore that some more. So we've asked for 2 more years. We're going to gather more data. As to these fees in particular, we looked at this profession will go into the advisor profession, which means that at OPR we have boards and we have advisor professions. The boards, their monies are siloed and kept within their board budget. So the Board of Nursing monies go to the Board of Nursing and are used for the regulation of nurses. The advisor model, all the monies are pooled and cover the advisor pool. This profession will go into the advisor pool. And we looked at what other professions are similar to doulas, what would be an appropriate fee both to cover the cost of regulation, but also not be a barrier to entry. We really want to make sure that we don't cause a barrier particularly in this profession, and what would contribute to the advisor pool on a continual basis. So this profession is not a drain from the pool.
We know, I remember whatever the last compact bill I reporting that we knew, that one may have been psychologists, but
It was.
we knew when we did it that you would lose revenue, that you lost when, because it's a more comprehensive fee and scope of where you can go. You can go anywhere that recognizes that license. And that we were going to have to find a way to support our Office of Professional Regulation.
Thank you.
Given that we kept giving all these fees away, but we also knew we were losing nurses because they could go over the border and get a.
Yes, and there's a real tension because we don't want to just raise fees on the people who stay and don't go out of state. And we want to make sure that Vermont remains competitively attractive to attract people to come here, and the compacts help with that, but also our fees help with that. Of course, housing and childcare obviously also help with those things, but when we hear stories about professionals of do I choose to go to Vermont or New Hampshire, the cost of the fee is one of the many variables, probably again, not as important as housing and childcare. But and we want to make sure that we're making good public policy, health policy determinations, supporting those in this building. And that frequently does mean that we lose fees when we join compacts. But that doesn't mean you shouldn't join compacts. We should.
We all go in to get our hair cut, assuming that person knows what they're doing.
That is the hope and intention.
And in that, we put our faith in you.
We'll do our best.
Not to mention other serious things involving sharp instruments. Okay, committee questions. Nolan, you have a.
Yeah. Oh, I should have zoomed in. I do. Just want to.
Madam Chair, while you're doing a transition, I didn't mention that the amendment was on the committee page is $25,000 appropriated to the Office of Professional Regulation for their.
No, that's good.
That's
This one over
So no one's
there.
going to talk about that, but I just wanted you to know
Okay.
that is already granted and
We already have.
comes with it and we'll send it across.
All right, so we need to get that bill out, so we put those across.
Sorry.
That's
I should have zoomed in. So I'm saying I'm trying to get in there. My apologies.
Oh,
It's my fault.
trustees.
Yeah.
Is it hard to do that or not?
No. No, usually you do it that way. Oh, when the person is doing the whole bill. Right.
All right. Apologies. For the record, Nolan Engel, Joint Fiscal Office again. I'm just going to guide you to a chart, top of page 2, my fiscal note. There are 4 things that I flagged in the note that have implications. First is in section 1, there are per diems, more of an appropriations thing, but nominal, and will be covered by the OPR special fund. Section 4, you have the licensure fees that Lauren and Jennifer talked about. Estimated revenues will be between 4,500 to 7,000, based on the information they provided to me. I'll skip over the Medicaid reimbursements because that's appropriations. And section 8 is another appropriation that Jen just mentioned, is the $25,000 to OPR for the bringing up to for the implementation of this profession based on all the things I talked about before, which is IT, et cetera, making forms, rulemaking.
Okay. Questions committee. Questions for anyone? What is your pleasure?
I'm happy to make a motion.
Yeah.
I will move that S53 as presented in our committee of finance be voted favorably out of committee on this day, March 18th, 2025.
Several of our Bullock has moved that we record. Yes, 53 favorably as presented. Is there any further discussion? If not, clerk call the roll.
Senator Chipman.
Yeah.
Senator Beck.
Yes.
Senator Brock.
Yes.
Senator Matos, yes. Senator Hardy.
Yes.
Senator Gulick.
Yes.
Senator Cummings.
Yes,
7-0-0.
okay. Does anyone want to?
Martine?
Apparently, are you guys, I mean, feel free to say no.
Well, would you like to?
Not really, because I'm gonna get the other two big ones that are in here this week.
I'll do that. I'll do it.
These aren't gonna cause any stir on the floor.
Oh, you never.
Depending on what we do with the other two, they could. Okay. Committee, we have votes scheduled next, but we've already done the vote. I believe we've done 1853. Yes, that's out.
You were silly.
Okay, and we are passing over the forestry vehicles until we get the entire. All right, we do not have our next discussion until 3:15. And then you might see if Rick and Patrick can come early.
I can, but then Damien and Logan can't.
Oh, okay.
Taking a break.
We're going to take a break until 3:10.
Wow.
Wow.
That's cool.
I know.